Good afternoon, good morning from wherever you are, and thank you for joining us on this fifth episode of The Future of Healthcare. This is a series where we're really reflecting on healthcare in a global pandemic and how different regions are impacted and how different regions are responding to the pandemic as well. And no more than from the country that we're visiting today and our guest speaker in South Korea. At the start of this pandemic, I was due to actually be meeting with Dr. Wang in HIMSS Orlando, and we were impacted immediately when people couldn't travel, but Korea was facing a rapid growth in numbers. But things have changed and things have moved on, of course, and we'll hear a little bit how this has been impacting Korea and what is happening today very shortly. But it really is a way that we can reflect across the globe how things are being treated differently in different ways. So thank you for joining us. We're going to do questions and answers. We want you to put those into the question and answers tab, which you'll see at the bottom of the screen. We want you to engage in this conversation as well. So we're going to have a presentation by Dr. Wang in a minute, and I'm just going to introduce you to him now and tell you a little bit about his profile as well. And so Dr. Wang is actually the CIO of Seoul National University Bundang Hospital in just in Seoul, a fabulous hospital. Very large, very modern building, great place to visit and to see the work they're doing. But he's been involved in for a long time in the development of technology and the use of big data and how that can impact patients' lives, dedicated to working with medical staff and IT professionals, providing intuitive systems that can work between the different teams of people. And obviously within Korea, has been part of this wave of management within the pandemic and using big data in that way. So I'm very pleased to invite Dr. Wang to do his presentation this morning before we start taking some questions. Thank you very much.
Thank you, Tim. Good afternoon or evening, everyone. My name is Hugh, as introduced. I'm originally a pediatric neurologist. Actually, basically I have no chance to take care of the pandemic patient, but as a CIO of my hospital, actually I have to work for the hospital to utilize the ICT asset to cope with this COVID situation. Next, please. Eitan, okay. As you know, at the early stage of the pandemic, the South Korea had to struggle with a really big surge of the number of positive cases. And also in that time, maybe 2 or 3 months before, lots of global countries has a kind of some concerns about the South Korea situation just behind China. As a number of the positive cases, but basically and in result, currently South Korea's situation is relatively well controlled in terms of the number of patients and especially in terms of the fatality rate, mortality rate. Our mortality rate is just around only 2%, so it's absolutely lower than the other compared the situation with a lots of numbers of positive cases. As I recall the previous 3 months experience, actually I got some lesson learned to share with you. The first of all, actually we have very strong governance from the government side, and secondly we have lots of medical staff who devoted to taking care of all this kind of patient. We really respect the sacrifice of all medical staff, including physicians, nurses, and technicians. And the third, actually, even if the government has a strong willingness to control the social distancing and some cooperation, and also the assigning the limited resources to take care of all the pandemic cases, without the cooperation from the civil world, it's not possible to control this kind of situation. So in terms of that kind of cooperation, Actually, the South Korean people show that the very, very positive, the cooperative attitude and manners to the government policy and also the recommendations from hospital side. I think that's to those three factors is a kind of some common factors in the countries who successfully controlled the COVID situation. But uniquely in South Korea, we have another the weapon, actually the ICT asset, the digitization, the weapon. As a CIO of one of the largest hospital in South Korea, I got a really biggest the lessons through the previous the experience. You know, the preparedness of ICT asset in the usual situation is really important to cope with some kind of crisis, acute crisis situation such as pandemic or some other, you know, the virus situation. In 2015, actually, we had a lot of lessons from the MERS situation. We got one of the highest number of positive cases and also the highest number of the mortality cases. After that, the government and the hospitals had a long-term plan to prepare some digital asset for dealing with this kind of acute crisis situation, which is going to be presented in my presentation. And also the government supported hospitals to be equipped with a sufficient ventilators and the negative pressure rooms and some other the processes to fight with the pandemic situation, which is unexpected. So the ICT preparedness in a usual situation is a key successful factor in South Korea to control the situation. I'd like to share our experience as an example how we utilized our ICT asset in this pandemic situation. Next, please. Next, okay. Here is a kind of some summary. And we have a nearly 30 tertiary intensive care unit hospitals to take care of the severe cases of pandemic, the COVID-19. I'd like to show some examples. The 8 hospitals, actually the 6 hospitals among the 8 largest and biggest tertiary intensive care center. Actually, the SNUBH, my hospital, is providing one single source-based EHR system. So I'd like to show why this is the important factor in terms of the big data analysis and the data gathering and making some new insight in this kind of crisis situation in a very the quick manner. Next, please. Based with our previous preparedness for the digital the healthcare system, we actually modified some of the functions and modules basically originally developed for the different purposes, but this time we just modified a little bit about that kind of solutions for coping with the COVID-19. Here are 5 examples. The first one is trace-based in-hospital traffic management aligned with the quarantine systems provided by the government. And the second one is the supporting community, the care centers with EHR extension for taking care of the less severe cases, the long-term follow-up. And the third one is the rapid response system to predict some kind of critical changes for inpatient cases. And the fourth one is on-tech teleconsultation system, temporarily allowed by the government in South Korea situation. And lastly, I'd like to briefly touch with the real-time data tracking and analysis. Next, please. Minimizing chance of in-hospital infection by controlling traffic of patients with high risk of COVID-19 Korea state. We actually modified our the triage systems for the emergency room. we basically aligned with these triage systems with quarantine the information system provided by the airport. So basically the patient visited the emergency room, the combining with the past immigration record and underlying disorders like some chronic disease or AG or some initial vital signs and other related information, system automatically divided patient into 4 different groups. The first group is definitely the suspected positive cases, and the last cases is a kind of some less probably the COVID-19 cases. Through this kind of triage systems, actually, right after the patient visit a hospital, the system can automatically guide it the which way the patient is should be treated and evaluated within the hospital system. Next one. And in South Korea, that was a kind of huge issues, how we can manage the less severe cases. For the severe cases, definitely they need a kind of some intensive care systems within the tertiary hospital or some community regional hospital. But for the less severe cases, actually, all the population has a kind of some concerning about the community-based spreading of the COVID-19. So basically the government recommended that kind of less severe cases to stay at home. But in some cases, if the patient is definitely positive with less severe symptoms, they need a kind of some care system. So for those kind of population, hospital and government cooperated to build a new community care centers. Actually, we modified some kind of some office buildings or some isolated buildings as a community care center. But the problem is that the human resources and the kind of some digital systems. So for the maximizing the human resources in a limited situation, we had to allocate just 3 or 4 physicians and nurses for each community care centers. In that cases, the original electronic the health record system should be extended to this kind of community care center, and also all those kind of vital signs gathered in the community care centers should be interfaced with the central system, and also the survey systems such as a kind of some subjective symptom surveys and basic the symptoms checking everyday checking system should be also interfaced with the central EHR system. Through this kind of the connected system, in the central command center, one physician can take care and check out the status changes for 50 or 60 community care center less severe cases at a glance. And so it can help the hospital to manage the patient in a very orderly manner. Next slide, please. And the third one is the rapid response system. Basically, we started our rapid response systems since 2013 to predict some kind of acute crisis after the surgical cases. As you know, basically just 1 or 2 days after the surgery is the critical period to fall into some kind of serious situation like the sepsis or some other crisis. So we have been running this kind of prediction system for past 6 years, but in this pandemic situation, we modified our algorithms and logics, based on the recommendations from our infectious control team to predict the moderately severe cases to change it to into the severe the cases which needs a kind of some ventilator cares or some intensive care unit cares. So basically it is one of the greatest benefit how SNUBH, my hospital, showed absolutely lower rate of mortality. Basically our hospital's record is under 1% for the severe cases in terms of the mortality cases. So we believe and we thought that this kind of prediction system prevent a kind of some crisis situations for the positive cases. Next one. And for the teleconsultation, basically in South Korea, the teleconsultation and the telemedicine is not legally permitted, but in this COVID situation, the government decided to allow this the teleconsultation in a temporary manner, especially for the reducing of the hospital visit for the chronic patient. In the crisis situation, actually one another side problem is that how we can manage the non-infectious chronic disease patient or some stroke patient or other kind of the urgent cases. So basically through this teleconsultation system, the patient, especially for the chronic disease patient, can avoid unnecessary hospital visit for their prescription or for their consultation. So I think that this the temporary the allowance for the teleconsultation will make a big change for the care paradigm in South Korea. Now the government and even some of hospitals really realize that the benefit of this kind of teleconsultation system. So basically the government currently try to expand this kind of telemedicine situation in South Korea. Next one. And as I previously mentioned, lots of big hospitals in South Korea has a kind of one single source based EHR systems, and also we developed the common the data warehouse systems, and also we are providing common data model for the data analytics. Through this kind of data warehouse systems is originally developed for the managing the quality control or some managing business intelligence. But in this COVID situation, actually we gathered all the critical data for the COVID analysis, and so far at least 20 or 30 different kinds of publications already shared with the global the countries through the the peer-reviewed publication. And also we can provide some kind of insight to the policymakers in government sectors. So currently in South Korea, government is still suffering from concerning the second wave of COVID. We have to prepare for how we can manage the second wave through the evidence. So this kind of data analytics systems and data warehouse systems is really important to manage this situation in a long-term perspective. So that is our 5 really important critical assets, how we are utilizing digitalized the systems for coping with COVID. And that is I think that's my last slide. Next one, please. Yeah, so I really want to share our experience with all the SBO members. So this is the end of my presentation. Thank you very much.
Thank you very much. That was absolutely fascinating, and we obviously see a vast difference between your numbers and the rest of the world, as we discussed. One of the obvious benefits that you had within Korea, which is quite sad, is the fact that you learned from your MERS experience and you started to gather data. Data privacy is something that's come up from quite a few people in previous questioning. How has the integration of things like the immigration system into the health record. How has that been looked at by the people of Korea? Do they see this as a benefit, or do they see this as partially of a threat? And just before you answer that question, can I just remind people to click on the Q&A button at the bottom of the screen and put your questions into there, so I don't hog all of the questions. Please go ahead and put some in. Thank you, Dr. Wang.
Okay. For the quarantine system, actually, the reason why we aligned with quarantine system with our EHR is that at the earlier stage, lots of patients has some fear to tell their, travel histories or some immigration record histories. So sometimes we found out that if we do not have the exact history of the individual travel, it will make some disastrous situations in the hospital. So previously, the South Korean government is providing the duplication checking system for all medication for all public. So the quarantine system is implemented into this drug utilization duplication checking system, and then this duplication checking system is already implemented and interfaced with each EHR system in each hospital. So it's really simple. It will take just 3 days or 4 days, and then after that kind of implementation, all the hospital can check out the exact the immigration histories for the travel outside. So it's really helpful for us to check out the patient the travel history, not just by the patient themselves speaking, or we can check out the evidence.
Excellent. In terms of that process that you went through in the different stages, the very earliest part of that was around the triage of patients into the hospital, etc. At that time, were you using patient engagement tools where they could record their symptoms at an early stage and be invited in? Or has that not been implemented at this stage in Korea?
We utilize the patient portal, the PHR systems for that kind of purpose. Actually, for the at-home patient or community care center patient cases, we started our patient portal service since 2013. Through the patient portal, actually they can input some of the vital sign data, or some, for example, for the chronic disease cases, glucose or blood pressures, and some at the necessary informations they can input by themselves, or if possible, all the data can be interfaced from the device directly. So in this time, we just modify our patient portal to gather the necessary informations for the less severe cases, such as the subjective symptom scoring, the modules, or some everyday, the morning body temperature checking. So through the patient portal, it is naturally interfaced with the EHR system, so it's also very simple. So that's the reason why I focused and highlighted the preparedness situation in the usual ordinary situation is really important to cope with this kind of crisis situation.
And very, very useful to get it early on within that process. Thinking about Korea, you have the advantage of having a single unified system across many of those, the hospitals that you're working with. In many of our other countries, we have fragmented electronic health records, fragmented electronic medical records. What are some of the key aspects of your data and the data structure, perhaps some of the code sets that you've implemented that could support countries who don't have that single system?
Actually, the South Korean government invested a huge amount of economic resources for interoperability since 2012. So basically, currently, although each hospital system is not unified and not the single-based source cases, all the system, the government recommend all the systems is equipped with the interoperability. So currently, More than 3,000 medical facilities are now participating in this interoperability system. So that is the one reason why we can gather the data relatively easier than the other situation. And for the standardization terminology cases, of course, the South Korean government has a kind of some very strong standard terminology set, like, you know, the ICD-10 based Korean version for the diagnosis. And for the reimbursement process, every medication, examination, and all those kind of elements should be mapped with the Korean standard terminology, which is a kind of different from the international standard. But in nowadays and at this time, the South Korean government realized that all those kind of local terminology also should be mapped into the international standard terminology set like SNUBH CT, RX norm code, or some, the ICMP for the nursing code. So currently, the South Korea government is planning to participating in that kind of global cooperation for the standardization process.
Excellent. We're going to go to our poll in a moment, just after one more question, but I'm interested in terms of utilization of things like artificial intelligence, big data analysis, and using the information that you have been gathered over many years of having a structured system. You have your news score. Are you using data analytics or AI effectively to understand your patients more now?
It is really fortunate in South Korea cases because, South Korean government and the hospitals started to think about the AI since 2013 or 14. Currently, the South Korea is operating some government-funded AI startup project, which is a little around 20 million US dollars. That is huge, big money. And actually, the Lunid or some Buno is a quite well-known AI company from the South Korea. So they basically developed their chest X-ray AI solutions and chest CT AI solutions maybe 3 or 4 years before. Currently, they have got approvals from the KFDA, US FDA, and the EU cases. So we completely are prepared for using that kind of AI systems in this kind of situation. One further step, Lunid and the Vuno opened their chest X-ray AI interpretation system for charge-free for anyone who wants to utilize their softwares in a global manner. So far, at least 30 countries and 100 facilities actually downloaded and communicate with the two companies' X-ray AI systems. It's really, really effective to shorten the time to make the basic initial diagnosis of the COVID-19 based on the chest X-ray, the findings.
Fascinating. That actually, I think, answers one of the questions that come in from Shubho Gupta, where it says that an article particularly talks about chest X-ray images along with AI to detect COVID-19 and shows South Korea as the use cases. So interesting to see some information on that. Now, we're just going to pause for a couple of minutes. We're going to do a poll now. Remember, don't put your hands up, put your question in the chat window, because then, in the question and answer window, we can then answer those questions. But we're going to go to our poll now. So we're going to put up on the screen. So what are the top 3 challenges associated with implementation of big data in hospital systems? So what we're asking you, the audience, to do is to look at that. Is it data capturing, data accuracy, data cleaning and data governance, data storage or security, data sharing between departments? What are the 3 challenges associated in your mind with those? So please put in your answers. We're going to leave that on the screen for a minute or so and give you time to thinking as well. I'll give you another minute maximum for that as well. And when we come back, Dr. Wan, I'm interested to talk to you a little bit about the telehealth. And I know that the Korean government unlocked the ability to do telehealth. And I just want to get some of your thoughts on whether that's here to stay or not within Korea, and what you see the value of those. We'll just leave the poll on the screen for another 15 seconds.
Okay. For the telehealth cases, I believe that in the future, there is no way to come back to the original status. You know, the lots of patients already recognize that the benefit of the teleconsultation and telehealth. Basically, currently, we need to think about all the medical paradigm should be focused on the patient-centered manner. So basically, there is a lot of debate about the safety of the teleconsultation still in South Korea, but recently, government, patient, and some of the basically community-based hospital and the tertiary hospital is now basically not against about the teleconsultation, the persistence. So I think that we are now already moving to another stage compared with the before the COVID-19 situation.
Right, a new normal. We've got our results in. Data capturing, data accuracy, data integrity, top of the list there at 78, just above data sharing between departments, healthcare providers, private and public sector. Interesting. Data storage and security challenges lower down, which is interesting. I think we're moving to a world where data capture is expected. I suppose security and privacy is expected to be there from the outset, and I think that's possibly why that's changed. So thank you for putting. We can take that off the screen now. I want to turn to some of the questions that are coming in from the audience here. So Alicia Chow, welcome back. One of the questions here: can you share more about the implementation of this data platform, and what were the challenges of implementing such a comprehensive real-time data tracking system? So what were your challenges in the first stages of this?
That's the reason. Actually, Alicia mentioned about the exact the pitfall or some pain point when we think about the implementation of data tracking system in a real-time manner. That's the one another reason why I highlighted on the preparedness is really important. You know, if we make a kind of new application and new systems after the pandemic, I think that's we have two big the hurdles. The one is that the timing issue, and second one is that no one can guarantee the safety and the security. But basically, all the systems were developed maybe 2 years or 3 years before for the different purposes. Actually, a lot of users are already used to utilize that kind of application. So there is one of the good way to minimize the end user's resistance. But basically, in a real-time data tracking system, which is aligned with the live poll questions, you know, for the data sharing, especially when the data size is really big, there is a lot of concerns in terms of the technical and in terms of the, in a real process, in a real department or real end user side. So in that point of view, actually the governance from the management at the hospital level and also the government, the principal is really important to facilitate that kind of the structure. In South Korea example, as I previously mentioned, our hospital is one of the biggest hospital in South Korea, which was received the stage 7, the highest level of HIMSS. And we actually have some consensus between all the end users within our hospitals to utilize the digital asset to enhance the patient safety and clinical excellency. So basically, they are ready to utilize that kind of tracking systems in spite of some argument about the data safety and data security. And also, in another side, we have a lot of the proof how we manage our data and patient data in a safer way through the lots of testing system, lots of indications, and a lot of the government approval systems. So as a CIO and the hospital management group, we also think about the two different factors simultaneously. The first one is the effectiveness of the system. Second one, we always have the backup systems to prove the safety and the security systems of the hospital information system.
Thank you. One of the other questions, Shemaine Xiao, I think, has come in and said, "What with much reliance on the EHS system, how is data security ensured?" And I think one of the questions, I suppose, is when we look at cloud-based technology, we're starting to see, I think, Korea open up to the prospect of electronic medical records in the cloud. Other countries, not so far away from you, have everything on premise. How do you ensure security when you open up some of these borders?
Basically, in South Korea, most of the university and tertiary hospital implemented their EHR on-premise basis, not cloud basis. But smaller hospital, and especially for the clinic cases, we recommend usually cloud systems rather than on-premise. Because if the hospital choose on-premise, they have to take care of all the security and privacy issues. But if they decided to utilize the cloud systems as EAS and the PaaS systems, actually the usual private or some public cloud systems is better than the on-premise clinic or small systems in terms of the privacy and security in a practical way. So in South Korea, that's the reason why even in our hospital cases, we are providing our system to other hospital on-premise manner in case of the 500 beds or 600 beds. But for the 100 beds or some less the smaller cases, in that cases we recommend the cloud usage in terms of the infrastructure.
Interesting. A question from Jose Angeles. In the Philippines, data cleansing is very much a big problem due to the late results from COVID testing. And there's a question: what do you think the government should come up with better data? I suppose one of the questions I have for you as well, which reflects on that, is your data capture within your system. Is it structured data, or do you have to do large amounts of data cleansing before you can do your analysis?
Yeah, actually, the Angeles mentioned about the data quality. We all know that the garbage in and garbage out. So the data capture status, actually, we have to comply with the standard, the method to gathering the data. For example, actually, Tim asked me, in my hospital cases, maybe nearly 70 or 80% of all data is input in a structured manner. But there is a pain point even in our hospital system for the physician's documentation. Actually, one of the most important data, the lake. So for those kind of unstructured data, even for the nursing statement, we actually applied for the ICMP-based EAV model for the structured the input. But for the physician cases, it's not possible so far. So alternatively, we are currently trying to adopt a natural language processing or some other data capturing. And for the very essential and critical area, we urge it and we force our physicians to fulfill their data in a structured manner, such as a kind of, for example, for the documentation of surgical note, at least surgery name, surgery starting time, and surgery duration, and complication checking, and the recovery room, the coming time in intake and out time should be input in a structured manner. For the some kind of descriptions, we allow physicians to use their natural language. So basically, step by step, we are moving on to the more structured data input systems, even for the physician documentation.
One of the challenges that you have in some respects is the control of the COVID situation within Korea has been very good. So in fact, the number of cases that you're seeing in your hospitals is still relatively low. So in some respects, you're perhaps not getting as much data as other countries who have very large cohorts of patients with this disease. However, do you think that the role of this data capture and the information you're gathering on your patients will help in terms of response to treatments, interventions, and perhaps potential drug development as well in the future?
For the COVID situation, actually, from the screening stage to the first visit notes cases, all the data should be input in a structured manner. We do not allow the unstructured data because, you know, this is the emergency situation. So through this kind of, for the usual ordinary situation, actually the physician needs their authority to input their data in their mind. But in this kind of COVID or some crisis situation, actually, in South Korea, we have very unique culture. Even for the, you know, physician cases, they feel that feel like complying with the government, the request to fulfill their the physician's documentations in a structured manner. So from the screening and the confirmation and all the treatment pathway, all the data is currently gathered in a structured manner. That is the why South Korean government can collect all the data so rapidly and make some new insight and make some publications.
Excellent. Now we're just coming towards the end of our time, so I want to thank you and apologize for people who haven't been able to get to their questions. What I just wanted to ask you one more question really is, where do we go from there here? What is the future of healthcare as far as you're concerned and big data? How would you sum it up?
In the short term, I think in conclusion, there is no way to go back to the previous status. We already know that. You know, the untact or some less contact, the procedures or some the care delivery system is essential to cope with another viral situation or another pandemic situation. So all the global should be preparing for that kind of situation. So in those kind of purpose, we need a kind of some asset and help from the digital health or some big data or AI. But before that, actually, we need to think about the how we can collaborate in a global manner. Actually, you know, there is a huge gap in a social economic status in each countries. For example, but in pandemic, actually, the virus does not, delineate that kind of social economic status. They actually they are spreading into the countries which is not prepared for this kind of the viral situation in terms of the policy, in terms of the cooperation, and in terms of the technology. So and there is when we think about the business and when we think about the way of our living in the global situation, there is no way to control the virus in a boundary to boundary in the nation. So in those point of view, actually, we need to think about the global cooperation really seriously through the kind of, the vaccine develop and vaccine dispatch and medical dispatch, and also the digital asset collaboration also. So I think it will be the really important factors of which we can successfully cope with another second wave or some another pandemic situation or not. Yeah.
Thank you very much. Thank you very much, Dr. Wang. It's been fascinating, really interesting to hear about Korea, particularly about Seoul National University Hospital, Bundang. Tomorrow, very early for me, we've got the future of healthcare going to New Zealand, where we're going to be speaking with Kate and Karen, who are head of nursing within that region. Very interesting again to hear of a different situation and how nurses are managing with that within the future of healthcare. Thank you once again for everybody for joining us. Please do register for tomorrow and we will be back. Thank you, Dr. Wang.